Mom, when are we going to get done with this? I have a movie to attend. My friends are waiting for me. See, I got a call. Yeah, I'm coming. I'm stuck with my mom in this hospital. Yeah. When are we going to get done?
So, are you next?
No, the one who just went in was my mother. I am just here to accompany her.
Okay. Did she went through, so she's a follow-up, was the first appointment, is she ill or something?
No, she just went through a major surgery, so it's just a routine checkup.
So, did it cost a lot of money? I mean...
Yeah, it did, but then she had her health insurance to cover it up.
So, do you have a health insurance?
Why do I need a health insurance? I am so young.
So, young don't fall ill?
They do, but then I don't think they need to worry about it.
And it costs money?
Yeah.
So, the last thing that a family wants to worry about when there is somebody who is ill in the family is money. So, at any age you need to have some kind of health cover. It could be by government, it could be by the employer of your parents or whatever in your case, or you could have taken it as in, your parents could have bought it for you, or depending on it, but depending on where you are living and whatever it is, you do require health insurance.
Okay.
When your mom went through illness, did you have to worry about money?
No.
Why?
Because she had a health insurance.
She had a health insurance, there was a health cover.
Yeah.
Now, think of it if you had to worry about that as well. It would have been more traumatic, right? The only thing that we want when there is anybody ill in the family is focus on doctor, on treatment, and ensure that person comes out. We don't want to worry about money, where will it come from? And when you have some kind of coverage, as I said, it could be a government giving, or it could be employer giving of your parents or whatever, it's that they are taken care of. That's a kind of health cover that we have. So you need to have that.
But there are so many options. How do you know which one is the best?
So I understand that. I can understand that concern, and as I said, some countries have government providing, they don't have to worry at all.
Yeah.
But even there could be some certain ailments which government may not be covering, or sometimes you need a treatment abroad, so you need to look at that. That could be one situation. It could also be that since you are still not working, but if you are working or if your parents are working, it could be some kind of health cover from the employer, or you have gone and purchased health insurance on your own, or it could be a combination of all these things. So first you need to check out what kind of health cover family has, and particularly you have, how is it covered, and thereafter, depending on country that you are living in and city that you are living in, what kind of treatment costs are there, which is the nearby hospitals that you are likely to go immediately. You need to look at that. See, all these things are important. So many times we ignore these aspects because it just comes like, I'm not going to fall ill, nothing is going to happen to you. But nobody's going to call you up and say, hey, you're going to fall ill, just go and get the health insurance, right? So look at these aspects. You could be consulting somebody, that they could be an insurance agent, they could be insurance companies. I mean, we get all these advertisements which comes on TV, and people send SMSs and WhatsApp, and all those things happen. Look at that, talk to them, talk to sometimes bank advice. There are various options you need to factor in based on your requirement, your circumstances, but we all need health cover. Health treatments are expensive, and last thing that we want when we are ill is worry about money.
Okay, sounds cool. Thank you.
You're welcome.